athletes and soldiers, people that do a lot of sports, they're always concerned, well, what about having some surgery to my eye? Will this make it so I can't do those things anymore? And I think it's really helpful for me personally. I've been in the Army for 30 years, and we work on Green Berets and Army Rangers. These are people who jump out of planes, they dive underwater, they're flying aircraft, they're doing combat, sometimes sports, sometimes for real, actually doing hand-to-hand combat fighting skills, training for this. And we're very comfortable doing the EVOICL for these patients. They tolerate it very well. So you don't have to think, well, if I'm an athlete or if I do sports, I can't do this anymore. Imagine what the US Army soldiers do, and most people don't do things that aggressive playing out on the sports field. It's always a little bit concerning for us as surgeons to operate on a well-known athlete who's doing very well, and now we're going to operate on their eyes. They're nervous, and we're nervous too. And honestly, I feel better doing an EVOICL for an athlete. So that's really a wonderful thing, which we've seen. And we have an NBA player who had gotten this surgery done, and that's kind of what he says. I see so much better than I used to, and I don't have to deal with contact lenses or having it fall out during the game or having some irritation in my eye and then having that affect how I play. I don't have to worry about that anymore. So it's wonderful.
視力最緊要清晰 clarity。